You are the nurse at a primary care clinic taking care of a 40-year-old male who is undergoing his routine annual well check. His only complaint is that about once per month, when eating spicy food or drinking significant amounts of alcohol, he experiences heartburn. Which of the following would be the most appropriate recommendation? A. Take over-the-counter omeprazole daily for 1 year. B. Go to the nearest emergency department immediately, as this could be indicative of a heart attack. C. Take over-the-counter ranitidine daily for 1 year. D. Take 1 to 2 tablets of calcium carbonate every 3-6 hours as needed for heartburn symptoms, and if you symptoms more frequently or severely, return to clinic. The answer is D. Take 1 to 2 tablets of calcium carbonate every 3 to 6 hours as needed for heartburn symptoms, and if you experience symptoms more frequently or severely, return to clinic. This patient is apparently healthy 40-year-old male whose only complaint is very infrequent heartburn that occurs in response to specific trigger foods and drinks, spicy foods and alcoholic beverages. In a patient who experiences mild to moderate heartburn, or acid reflux, symptoms infrequently, meaning less than 3 times per week, the appropriate initial recommendation is to take over-the-counter calcium carbonate tablets as needed, as these will directly neutralize the excess acid in the distal esophagus and stomach. For the majority of patients with infrequent heartburn brought on by known trigger foods and beverages, this will be sufficient to provide symptomatic relief. It is inappropriate in a patient with infrequent heartburn who has not yet tried, and failed, calcium carbonate to initiate ranitidine or omeprazole treatment, as these are more potent methods to suppress intrinsic stomach acid production, and are not necessarily required to provide symptomatic relief for these patients. If the patient in this example was experiencing more frequent heartburn, more severe heartburn, or heartburn that was not adequately controlled by calcium carbonate, then ranitidine or omeprazole would be reasonable options. The best initial treatment option for a patient with heartburn is not acetaminophen, an over-the-counter analgesic. Heartburn is caused by reflux of acidic gastric contents into the distal esophagus. The best initial treatment for an acute episode of heartburn is calcium carbonate, as this will directly neutralize the acid that is causing symptoms, and provide symptomatic relief for most patients. It would be inappropriate to send this patient immediately to the emergency room as he is not currently experiencing heartburn symptoms. His symptoms are highly consistent with heartburn, as opposed to a cardiac etiology, given that they are brought on only infrequently and directly in response to trigger foods and beverages. If the patient was actively complaining of chest pain, and more concerning aspects of his pain were elicited that suggested a cardiac etiology, then an immediate referral to an emergency department would be a more valid consideration. A client presents to the clinic for fecal occult blood testing, FOBT, as part of his colorectal screening appointment. The nurse previously instructed this patient to avoid certain foods for 48 to 72 hours prior to testing. All of the following foods were to be avoided except A. Turnips. B. Prunes. C. Beets. D. Red meat. E. Cantaloupe. The answer is B. Prunes. There are many foods not to be ingested just prior to FOBT. Prunes are fine to eat. Red meat, broccoli, cantaloupe, beets, turnips, carrots, horseradish and several others may alter the test results and should be avoided before a FOBT. A 70-year-old female client is being treated as an outpatient for diverticulitis. The nurse explains that there are several complications associated with this disease. The nurse informs the patient that diverticulitis is the most common cause of what complication? A. Renal failure. B. Severe diarrhea. C. Bowel obstruction. D. Peritonitis. E. Lower gastrointestinal bleeding. The answer is E. Lower gastrointestinal bleeding. Diverticulitis is the most common cause of lower GI bleeds. Peritonitis and bowel obstruction are possible complications, but not most commonly associated with diverticulitis. Renal failure and severe diarrhea are not complications of diverticulitis. The pediatric nurse assesses an 11-year-old patient in the emergency department. The child's parent explains the child's signs and symptoms from the last few days. Which of the following statements by the parent is most important to the nurse? A. He was complaining about a strong pain in his stomach, on the right side above his hip. B. He has a fever around 99.5 degrees Fahrenheit and has thrown up a few times. C. He has been feeling this pain for the 2 days, but it suddenly went away. D. When he walks, he holds his arm around his stomach. E. He hasn't been eating very much since the pain started. The answer is C. He has been feeling this pain for the 2 days, but it suddenly went away. This patient is experiencing signs of appendicitis, which include periumbilical abdominal pain, usually originating in the right lower quadrant, anorexia, nausea, vomiting, localized tenderness, muscle guarding, and a low-grade fever. Appendicitis is frequently diagnosed in young children and young adults with these symptoms and a white blood cell count from 15,000 to 20,000 cells per cubic millimeters. The nurse should be most concerned if the pain has suddenly ceased, which may be a sign of perforation, which is an emergency due to hemorrhage and infection risks. The pediatric nurse cares for a young child admitted with appendicitis. Which of the following signs and symptoms most concerns the nurse? A. Distended abdomen and abdominal rigidity. B. White blood cell count of 18,000,16,000, and 17,000 cells per cubic millimeters over 3 days of hospitalization. C. Temperatures of 99.6 degrees Fahrenheit, 99.2 degrees Fahrenheit, and 99.4 degrees Fahrenheit on the shift. D. Tenderness of the abdomen in the right lower quadrant. E. Anorexia, nausea, and vomiting. The answer is A. Distended abdomen and abdominal rigidity. Without treatment, appendicitis can lead to peritonitis or perforation. Typical signs and symptoms of appendicitis include periumbilical abdominal pain, anorexia, nausea, vomiting, localized tenderness, muscle guarding, and low-grade fever. The normal WBC count for a patient with appendicitis ranges from 15,000 to 20,000 cells per cubic millimeters. The nurse caring for a patient with appendicitis should always be aware of particularly concerning signs or symptoms of peritonitis, especially those that differ from established baseline signs and symptoms. Many of the symptoms of appendicitis may be apparent with peritonitis, especially tenderness, fever, and white blood cell counts. When assessing for peritonitis, the nurse should specifically look for abdominal rigidity or distension, rebound tenderness, increased, severe abdominal pain, ascites, increased temperature, increased leukocytosis, and paralytic ILS. What is the incubation period of hepatitis B, HBV? A. 1 to 2 weeks. B. 2 to 4 days. C. 1 to 6 months. D. Up to 2 years. The answer is C. 1 to 6 months. Hepatitis B has a long incubation period. From the time of initial infection, symptoms might take from 1 to 6 months to appear. A patient just returned from a trip outside of the country and is now experiencing fever, nausea, and vomiting. She tests positive for hepatitis A IgM. She would like to know if hepatitis A is a chronic infection, or if it will resolve with treatment. The nurse should advise her which of the following? A. Hepatitis A is not a chronic disease and it does not exist in a carrier state. Once the infection is resolved, you will no longer have hepatitis A. B. Hepatitis A becomes chronic in 25% of cases. Monitoring for viral DNA should be repeated every 6 months. C. Hepatitis A becomes chronic in 75% of cases. Monitoring for viral DNA should be repeated every 6 months to 1 year, but you will likely always carry the disease. D. Hepatitis A generally does not become a chronic infection, but you will always be a carrier of the disease. The answer is A. Hepatitis A is not a chronic disease and it does not exist in a carrier state. Once the infection is resolved, you will no longer have hepatitis A. Hepatitis A is a generally benign, self-limiting disease that does not develop into a chronic hepatitis. It also cannot exist in a carrier state. Once the virus is cleared by the immune system, the individual will no longer carry the virus or be infectious to others. Hepatitis B can be transmitted via any of the following routes except A. Blood. B. Stool. C. Vaginal fluids. D. Semen. The answer is B. Stool. Hepatitis B is primarily transmitted via blood, vaginal secretions, and semen. While the virus is often present in saliva, it is not generally spread by sneezing, kissing, or sharing utensils, unless there are oral abrasions resulting in a mutual exchange of blood. The virus does not have fecal-oral transmission. A patient with pancreatitis is placed on an NPO order. What does this order mean? A. The patient cannot walk. B. The patient cannot eat only. C. The patient cannot drink only. D. The patient cannot eat or drink. The answer is D. The patient cannot eat or drink. NPO means is a Latin phrase meaning nothing by mouth. This order is used when a patient is not allowed to eat or drink any substances, usually due to a disturbance within the GI tract or if they are scheduled for a surgery. NPO orders are common in the ICU and surgical setting. A client with Crohn's disease is asking the nurse how to accomplish a low residue, low fiber diet. The nurse will tell the client to avoid A. White bread. B. Cooked potatoes. C. Refined pasta. D. Apples. The answer is D. Apples. Crohn's disease is an indicator for a low residue, low fiber diet. The diet should include foods that are unlikely to obstruct the intestinal tract if narrowed by inflammation or scarring, or if gastrointestinal motility is slowed.